This is the Grow Your Clinic podcast from Clinic Mastery. We help progressive health professionals to lead inspired teams, transform client experiences, and build clinics for good. Now, it's time to grow your clinic.
Well, welcome back to another episode of the Grow Your Clinic podcast. My name is Jack O'Brien, your host today, and I'm really excited to bring you another guest for the podcast. I have with me the CEO and co-founder of Physitrack, a software that has changed my life and my clinic, if you can say that about a health tech software. But we have Henrik Molin joining us, the CEO and co-founder of Physitrack. Henrik, how are you today?
Very good. Happy to be here, Jack.
That is awesome. Well, most of our listeners would be familiar with Physitrack. It is such a brilliant addition to most clinics' suite of softwares. But for the uninitiated, Henrik, can you tell us in a nutshell, what is Physitrack?
So we're a patient engagement platform, which means that we are tethered between patient and clinician in many sorts of ways. The most common use of Physitrack is through exercise prescription, meaning that something that a physiotherapist or a neurologist or a pediatrician or even a psychologist would use to prescribe exercises, educational content, and outcome measures to a patient when they are not in front of you and in hands-on treatment. And we are a cross-platform technology, so you can use us on web, iOS, Android. We're part of Apple's accelerated program, so a lot of the design stuff that you see in the application has been done by them, so it will feel quite familiar if you're a keen smartphone user. We're in about 100 countries today. Australia is especially a very, very good friend of ours. We have very, very high penetration there and very high usage, so we just really love Australia for many reasons.
and likewise, we love you. A lot of our listeners or those who have attended any of our Grow Your Clinic workshops in the past might be familiar with Marijin, who has spoken at some of our events and has been a strong ambassador for Physitrack for a long period of time. Henrik, just out of interest for listeners, if they can pick up the accent, tell us what's your heritage, what's your background, mate?
So I'm Swedish, so I'm kind of like walking, talking UN. So I'm Swedish. I live between London and Monaco. I spent a lot of time in the US. I have an Australian girlfriend and a Dutch co-founder, and so yeah, it's a mix and match of everything. So
I love that.
I left Sweden in the 90s, and so I lived abroad since I was in my early 20s.
Oh, amazing. Very interesting. Well, what we might do, you've got such a fascinating story as a co-founder. I'm really excited for listeners to learn more about your journey, but so that we can get a bit of an insight into you, we've got a couple of icebreaker rapid fire questions. So are you ready for those?
Go for it.
All right. First one, what are you reading or learning right now, Henrik?
So I usually rotate between 3 different kinds of books. I try to read a book a week. And I switch between business, literature, biographies, and fiction. So what I have currently on the nightstand, I have the biography of the Netflix co-founder. It's called That Will Never Work. And it's about Netflix, and obviously that did work. It's a fascinating story. I can highly recommend that. I'm also reading a historical account of Chateau Marmont, which is called the Castle on Sunset. Because I was actually in Los Angeles over the last few days before coming to Houston, and so I got fascinated by some of those old Hollywood stories. And I'm reading The Second Sleep by Robert Harris, which is one of my favorite thriller writers. So it's I'm rotating between those 3 things. It's usually good for the head, especially the fiction part of things.
Yeah, unreal. I haven't dabbled in fiction much myself yet, but last year I committed to reading a book a week, and it was one of the best things I've ever done. It was a fantastic exercise.
It's very good for the head. I try to wrap up each day by reading. I use the Kindle in night mode, so you have the black background that makes it easy to sleep. And if I get through half a page, or if I get through a few chapters, it doesn't really matter. But it's a great way just to wrap up the day, just clean the head of anything else really.
That's awesome. I love it, and I'll be adding that Netflix book to my Kindle wish list for sure. Okay, number 2, who inspires you?
Well, my dad is my biggest inspiration. So he's the Uber entrepreneur as far as I'm concerned, and you see a lot of his DNA in our business. So he built a travel business over it was over 40 years. We were in that for as long as for as long as I can remember. And the way that he built and scaled his company based on no outside capital, on just carefully growing the business as he made more money with it, and during tough times, just being careful with the size of the team, but stepping up on advertising to gain market share. And so I think about my dad every single day in the context of business. It's quite important, especially in this day and age where everything is just sort of venture capital fueled and it's based on maybe an artificial way of building growth. It comes at a cost of a lot of things, lack of control, and also the lack of actually respecting risk factors in your business. My dad did it very well, and he's the guy I really look up to.
That's amazing. That's awesome, mate. Thank you for sharing. Now, what did you want to be growing up? I'm fascinated by this question, and I'm excited for your answer. So what was it for you? What did you want to be?
Yeah, I mean, I think there were a couple of things that were up there. I went to music school when I was a kid, and I played the guitar. I had bands, and I wrote music. I guess I dreamed about being a rock star, and so that returns in like the narrative when you look back at old school books and things like that. I unfortunately discovered mathematics and chemistry and physics and stuff. And I did the science program when I went to high school, which was quite a demanding education. And so I dropped the guitar playing more or less, and didn't take that up for a very long time. But that was that was one of the dreams growing up. And other things you dabbled with. Obviously, I think an actor. I was interested in acting, and I put on some comedy shows at my school when I went to middle school, and so that was
right.
Something that was.
And any of those floating around in the annals of YouTube anywhere?
Not that I know of, but you never know. So it could be under one of my stage names, rockstar actor. I was too tall to be an astronaut. Otherwise, that would probably been up there.
And finally, Henrik, what's a motto that you live by?
The big one is obviously execution is bigger than the idea, and that's something that I have on my WhatsApp profile. You just have the execution, or you have the bigger than idea, because for a lot of things that you do as an entrepreneur, it's not so much just about having the idea. You actually have to implement that, and there are a million things that you need to think about that are beyond the idea. And I live by this very, very much. I always think about the execution. Whenever people come up with new things that we should be doing, you look at the actual way to go into it, and that's what really drives something to completion or to success.
That's awesome, mate. I love it. And that really resonates. We often talk around the clinic mastery world of progress over perfection, and not getting hung up on perfection or the idea, but it's the execution that matters. That's unreal, mate. Thank you.
Yeah. Then it's also obviously just looking at the journey more than the end destination. That's quite important from what we do. But I think idea versus execution, and that's a very, very big one for me and for us as a business.
Unreal, mate. Awesome. So obviously, as talented as you are, you didn't end up on the rock stages and the small screens. What's the journey from the young budding guitarist through to co-founding a tech app? What's been your story and your journey to get you to where you are today?
Yeah, me personally, I mean, if you start at the end, I mean, Physitrack was not really something that I thought I'd be doing. It was just a very lucky break for me. I describe it sometimes as slipping on a banana peel and just ending up in a global digital health business, because the way that came up was quite random. But just seeing it, my life leading up to that. So as I mentioned, the love of mathematics and some of the more hardcore subjects in science that led me into the financial world at a pretty young age. And I started with risk management software sales with Reuters back in the 90s. I was sent to Asia to build a business for Reuters in risk management, working with some of the central banks at the back of the Asian crisis of the late 90s. I eventually evolved from that role into trading, and so I was part of hedge funds, and I did quantitative trading. I did special situations trading for a big chunk of my career. And I eventually migrated into business development for hedge funds. And that one of the last thing I did before Physitrack was to be in charge of all commercial efforts for a very large American hedge fund, Skype's Capital, which now manages $12 billion. I ran that business in Europe. So it's an interesting little path. And Physitrack was something that came up with my brother-in-law having had knee surgery, and he was given a piece of paper for his rehab. And he was quite surprised, and this is now 7-8 years ago, that was the case, that you didn't have an app, you didn't have a website. He showed that idea to me, which at the time was called the post-op patient tracker. And I said, you know what, you know just the guy that we could show that to, which was my best friend and a very accomplished entrepreneur, Nathan Squatchov, who had 2 big tech exits behind him. So I took the idea to Nate. We decided to set up a company, and I would love to say the rest is history, but the rest was a lot of hardcore execution over a number of years before we ended up where we are now.
For you personally, there wasn't a specific health background?
No, I don't have a background in health. I've had my fair share of MSK and orthopedic troubles in my life. Obviously, given that I've had desk jobs, I've been quite keen on physical training a big chunk of my life, and so obviously I've been in and out of chiropractor offices and physiotherapy offices, and I've had my fair share of scans and X-rays, and had the need to fix stuff. So obviously, from a patient standpoint, which is quite important for the patient journey that we now capture digitally. That was quite important for some of the development that we did, just to have been on the receiving end of that. But in terms of healthcare, nothing like that at all.
Henrik, there's some interesting threads to pull on there, and I think about Physitrack now, world leader. You're in how many dozen countries are you guys in across the world?
Last time we measured that, we had customers in 102 countries, and it's probably more today. So it's around about 100 countries, and so it's quite amazing just to see when you run the map of where your clients ping you from, and you can see things on all continents. I haven't seen a team in Antarctica yet, but I'm sure that there's somebody doing remote patient engagement down there. But it's quite amazing just to see just how wide and how quickly that you can achieve usage around the world. So that's been very fulfilling for us.
At the risk of distraction, I know we've got listeners and clinics that we work with in Tasmania, which is pretty close to Antarctica, and I know that Brad Beer of Pogo Physio, a key friend of Clinic Masteries, was remotely looking after an adventurer through the Antarctic. So perhaps inadvertently, Physitrack has made it down to the South Pole. But I think about your story, and I'm imagining the stereotypical pinstripe suit of a hedge fund manager who then leaves what could be seen as a stable job to start up a health tech app with no health background. I can picture, the 2 guys in the garage story of Apple. And so tell us about how that really came to fruition and how you took the jump from corporate world and finance into an app startup.
Yeah, well, listen, so one thing that's important here, and I think that's a good takeaway for any aspiring entrepreneur, your day job is very important for funding your venture capital situation, because or your venture, because you can actually, just because you have a day job, it doesn't mean that you necessarily have to give up on an entrepreneur dream. And it's not black or white. I don't think it's either or. So in my case, I actually held on to my day job while I was doing Physitrack at the embryonic stage, and while we did some of the key business development stuff. And so I managed to swing that, early mornings. I managed to swing it late nights. The launch in Australia made it possible for me to do that from Europe, because the work with Marijin Kortekaas out of Melbourne meant that we interacted, probably from 6 a.m. to 8:30 a.m. Before I got to head on to my office, and then again in the evenings from 8 or 9 p.m. and throughout parts of the night. So I made an effort out of keeping my day job for as long as possible, because it was actually providing financial stability. It was a risk mitigator. And obviously for my head, it was good to be able to know that even though if it would fail with Physitrack, I will still have my day job. So I just worked double. And this is what I say to people that contemplating making a move from a day job to a startup. I usually say, whatever you do, don't let go of that day job, because the day job will actually fund you. You're your own venture capitalist, and that's what I did for quite some time. The jump finally, I realized that it wasn't just from a workload perspective, from number of hours, and just from a health perspective. At some juncture at the end of 15, after we got accepted into the Apple Accelerator program, and I saw that where things were going and things were really taking off, I just realized that it would be impossible for me to just hold on to this. Plus, Physitrack was getting more visible, my name was getting more out there, and I think it was just a question of time at that point before it would be a tricky situation for me. So I left in early 16. And so, there were a fair amount of risks left with Physitrack at that point. Certainly we're not profitable. We most certainly weren't paid for a very long time. But because I came out of that double job situation, it was a pretty easy decision for me to make from a risk reward perspective. So that's that's the story on my side. But I do think that a lot of people could benefit from that. Just use weekends, use early mornings, use evenings. Use bathroom breaks. I mean, the bathroom break checking emails, that was a big one. I'd schedule conference calls during lunch hours. And just whenever I had spare time, it would be Physitrack.
Yeah. And I think that'll really resonate with clinic owners. In a lot of senses, clinic owners transition from being on the tools or seeing patients full time to then having to run their clinic perhaps in their spare time. And, you don't magically come off the tools and stop treating patients and a full-time clinic owner until perhaps the clinic is grown to a certain level. So that I'm sure that will definitely resonate. It seems like app development wasn't what you'd studied. So how does one learn to grow a business in a space that's not in your wheelhouse?
So the most important part of founding a business, and for tech specifically, I think it's very important not to be alone. You have to have ideally one more co-founder, maximum two more co-founders, but two is the ultimate size, I think, of a founding team. In my case, I was and that is why Nathan Squartzov was top of mind for me when this idea came up, because he was such an accomplished entrepreneur with a great track record. He had studied, he had developed for internet applications and website stuff for a good, for more than a decade and a half at that point. And so I knew that somebody needed to do architecture and design and coding, and so that was a very key thing. And then obviously the process of getting to what we needed in terms of an app was based on talking to people and understanding the needs. So my brother-in-law's idea, so he is an accomplished medical device business developer, and so we could tap into some of his network for understanding the needs of this, and we could invent something based on customer feedback. And the actual development process or the coding process is not that complicated once you understand the customer's needs, once you can architect and design and prototype around it, which is Nathan is a genius when it comes to that. And I was very fortunate to have him in my life as we did that. Now, the trick here when you launch something is actually to make sure that you don't go too far in the development process as you develop an app. So if you don't have to launch the Ferrari of a solution to make it and to be successful, what you need to do is you need to build a skateboard, a minimum viable product that you can test in the market, or you build on the basis of what customers tell you. You test it with customers, you see if they're willing to spend money on it. If not, then you have to iterate it and you need to change it. If they do, then you dig deeper into that, and then you go from there. So you take it from the skateboard to the bicycle to the to the moped to the motorbike to the Ducati motorbike, and eventually maybe one day, I don't think we're at the Ferrari stage yet with Physitrack, but at some juncture you have something that actually works very well, and it has product market fit, and it can become profitable. So just very careful steps. So back to the lessons of my dad, very, very carefully build your business, pivot your business, and try to find product market fit. You scale when you hit that, and obviously with a co-founder that's very skilled in design, architecture, and prototyping, that's going to help you get there.
Okay, so I've got two questions on that story. I'm thinking about clinic owners and business owners that are perhaps hesitant to enter into partnerships, or maybe they've been burnt or had negative experiences in around business partnerships. Do you have any advice for clinic owners to make those relationships work really well?
Well, there is one big piece of advice, is that you know them very well. It actually helps being friends with your co-founder before you start. Because if you've gone through some stuff together as friends, then you sort of know where you have them if you go through stuff as a business. And you will go through some really tough times. It doesn't matter what the business area is or what you do. Inevitably, there will be some rocky roads ahead, and to know who you're dealing with is quite important. In our case, we were close friends. We had gone through some things that on a personal level in our friendship that made it quite easy for us to understand each other and to respect each other as things got difficult. So that's quite important. On a technical level, in terms of a legal framework with a co-founder, I can highly recommend a vesting scheme for share ownership, meaning that when you start a business with somebody, you portion out the equity in the business over a number of years, as rather than just saying, what, it's you and me, it's 50-50, let's just go. Because of the rocky times that we will be going through, you can't be 100% certain that your co-founder will make it through the rocky times, even though you're friends and all that stuff. So a way to just ensure that you have an option to work with somebody else, to put a vesting scheme on it. So just make sure you portion out the equity over the first maybe 4 years, something like that, so that you don't give somebody a chunk of the equity up front. Now, if you're doing something with somebody that's very close to you, you can trust them 100%. You know them for decades, and you know that they're not going to go anywhere. You might have had a history of building a business with this person before. Then, by all means, you can probably split the business, in the middle at the beginning, and not have any issues. But vesting is quite important for the co-founder situation.
It's really good insight, Henrik. Thank you. And I know there's a lot of clinic owners that dabble in technologies or inventions, and I think that's a huge takeaway. That's a massive lesson. Thank you. The other thread that I wanted to pull on was around the minimum viable product and getting your ideas out there. I know that there's a potential for skepticism or a fear or a scarcity mindset to creep in. How did you feel about releasing a product that could potentially be ripped off, or when competitors came up with copycat products? How do you wrestle with that tension of MVP versus giving away your IP too early?
Well, so we were always in the mindset that without Pepsi, there would be no Coca-Cola. So we always thought that if you have a great product, and of course people are going to try to do the same thing, you just have to make sure you have the best product and you have the best process, and you are a step ahead of the competition. You have the best partners, you have the best distribution. There's a lot of best, in that monologue, but there are other places. So again, execution is always bigger than idea. So a lot of people can have an idea, they can have a product, they can try to copy you, but at the end of the day, your execution, both in terms of the development process and then the commercial development process, can be so superior that they won't stand a chance. And so we actually never looked very closely at competition as we were launching. I don't think there was a lot back then, but there's nothing that we really cared about. And to this day, we're very focused on listening to our customers and making sure that that we capture what they want, and we're reactive, we're proactive. We try to figure out not only what they want now, but what they want in a couple of years down the line. It's very hard for a competitor to catch up to that. So long story short, if you excel in providing a service or a product, I don't think you have to worry much about competition.
Mm-hmm.
But always be on your toes, obviously, and just make sure that you always, you never sit back and you never content. You always take that piece of feedback seriously that you get. You look at your data. You look if things are slumping in a certain area or for a certain part of your product, that you get to the bottom of that by talking to your customers. It's very, very important. But I wouldn't be afraid of the MVP situation, because there's so much else into it. You can have an idea, you can have a product, but there's just a million other things that need to come into that for it to work. So if you feel that you have a great team and you have a great process and you have a great product, release that as an MVP. Just try to pivot that so you find product market fit, and you will see it will work really nicely from there, regardless of who's out there in your space.
So good, mate. So good. I think that healthy blend of, like you say, keep your finger on the pulse, stay close to your customers, and trust your data. But then you've got that laser focus on, where you're headed, stay in your lane, and don't pay too much attention to competitors. Sounds like it's boded you guys very well, and a great lesson for clinic owners. So, Henrik, if you didn't pay much attention to what others were doing in the space, and you knew you were onto a good thing, you were executing, what keeps you up at night?
Well, so these days, we're doing a lot of stuff in North America. I'm happy to be in North America right now to do this call, because that means that I don't have to stay up at night and do calls and get involved in the business development process. There's some very positive things going on around us that sort of bring the type of excitement that gets your head spinning at night, and so that might be difficult for you to go to sleep sometimes. With the Canadian Physiotherapy Association just came out with a big endorsement. It's the first time that we had a national one in North America, which is huge for us. Some of the biggest hospital systems and clinic chains here in the States, they're going after us, which is a huge achievement for us. So that's been literally keeping me awake, but more for business reasons. Now, as an entrepreneur, I think it's very uncommon to actually have properly restful nights, especially at the early stages, because there are a lot of stuff going on at all times. They can be good or they can be bad, and it doesn't really matter what stage you're in the business. We're never happy with where we are in the business. I keep thinking about what customers want, and recently it's something that I was thinking about literally at 3 a.m. when I was going to bed in New York. And I was thinking about the data capture around customer needs and wants, if there's a better way to collect that and without disrupting or just being overly nosy in terms of who they are and things like that. So Nate and I, we're actually revamping the whole way that we analyze customer activity and customer behavior in terms of how they purchase from us, and we're trying to communicate those to them in a way that's not intrusive, but in a way that we can analyze them. So a lot of the data stuff and the process around collection has kept me up. So, starting in we are not doing enough to understand our customers, and then that translates into excitement over it, and you're churning different type of strategies in your head. But to be honest, I try not to let Physitrack disrupt my sleep that much. And I try to live a healthy life overall, and I think about what I eat and what I drink, and the process of going to sleep. Yeah, the reading is a big thing. That Kindle with a night mode that I have, it's very, very important for just winding down. And because there will always be stuff that you'll be thinking about. If you're excited about your business, there are elements of kind of worry in that excitement as well. Are you doing enough? And this is taking off, but can we sustain it? And so it's generally a good thing. I'm very lucky to have an Australian girlfriend who's absolutely amazing, and she's good at whacking me on the head and telling me to go to sleep when it's needed, and just she gets me unwind very, very well, which is absolutely lovely.
Amazing, mate. Really, really good insights there. And I see Physitrack and certainly yourself at the cutting edge, the forefront, and you guys live in worlds that are sometimes years ahead of what's happening on the ground. So when you look at healthcare experiences and the delivery of healthcare, what key developments do you see on the horizon from, let's say, from an experience perspective when it comes to healthcare?
Yes, that's a good question. So there are two main things that we see at the moment, and this is something that we see globally. There are two things that are happening that are quite interesting. One is telehealth. You're seeing the legislation loosen up around telehealth in a lot of geos and a lot of jurisdictions. This is something that's become more common now in our space, in the physiotherapy space, because it's just an equation of people having less time to travel physically to do appointments, and obviously technology picking up to cater to that digital care provision or the pathway, if you wish. And you're seeing that consumer behavior filtering through on regulation and reimbursements and things like that. So that's a pretty big thing. And you see now that business models for a lot of the bigger chains that we speak to, they all have telehealth as on their roadmaps for the next few years, as a complement to the hands-on treatment. And so just catering to the busy lives of their customers, their patients, and introducing new business lines around it. And I think it will become more and more mainstream, where you will see a more systematic mix of face-to-face, hands-on care provision and remote care provision. That's quite important. Another thing that we're seeing is the use of outcome measures and outcomes data in tandem with care provision. Now, so obviously it's quite common for healthcare providers to poll their patients and to make sure that they're on top of who the patients are and how they're feeling. The way that's translating into more outcomes-driven medicine or outcomes-driven care pathways is quite interesting. So in a number of countries, you start to see moves from the public healthcare side of things for stimulating the collection of outcomes data, because at the end of the day, that's something that's teaching that's teaching care providers and it's teaching healthcare systems, and it's teaching regulators about the behaviors and the needs and wants of the patient. And so you're starting to see that, and you start to see a stimulation of that data collection process with initiatives here in the States, for example, like MIPS, which is a way that healthcare providers can get a bonus from collecting and delivering outcomes data to the Medicare system, for example. This is something that I think we'll be seeing globally, and there's a big interest for it. In Australia specifically, the Australian Physiotherapy Association has started working on a large-scale population health type project using outcomes data collection and analysis to understand the needs and wants of the Australian patient or the Australian consumer in physiotherapy. And that's something that we'll see over the next few months, a systematic effort to work with physios and work with clinics over that, and for the clinic owners and for clinicians to work hand in hand with patients to provide that, just so that this is more understanding around what the patient's actually facing. And so the APA, they're working with us on that, so we're the tech providers in that project. And we're very happy about that. We introduced ways to do population health data collection and analysis as part of the Physitrack process, and the data repository stuff, and the anonymization of data, obviously, and making sure that the patients, they're happy to tell their clinicians, their care providers about how they're feeling and how they're doing, and that the data is then aggregated and passed on for bigger analysis and big studies. So there's a quite interesting development. These two things, the telehealth and the outcomes, they both mean, in a way, the challenges to clinic owners, because in the one hand you have you have to take a stab at a new business model and a new revenue stream for your business. You have to figure out how that's going to fit into your practice. And so obviously the staffing of that, the processes and the tech around that, those are challenges to get your head around. We obviously do our best to help on the tech side, just to make that easy, because you have telehealth that can be easily switched on in Physitrack. But obviously from a culture perspective, as an entrepreneur, there's some risk reward calculations and some decisions that have to be made that are not always easy. Same thing on the outcomes data side of things. If you have these regulator stimuli or the governmental stimuli to push for more data, that obviously pay more for the reimbursed care, but that also means that you will have to put a process in place to get that done and to get the reporting done, which and also the culture around it, which is usually the bigger challenge. And even though the tech is easy, again with Physitrack you have that weaved into the tech, but just the wrapping of it and getting your head around that as a clinician, that can probably be a bit of a challenge. But those are the two main things that we're seeing that are upon us now, and that will be a big influences in the industry over the next couple of years.
I absolutely agree. And it's funny the different perspectives that you can bring to those two challenges. They can seem like insurmountable. I'm thinking about the clinic owner that might see themselves as a technophobe or very concerned about privacy and what does the government want. And so telehealth and outcomes becomes a real threat. Or looking at it through the lens of opportunity and experience and go, what an opportunity to craft amazing client experiences using tech and telehealth and different realities of augmented or virtual. And then the outcomes piece of we get to work with governments and insurance companies and other parties. And as we work collaboratively, at the end of the day, patient outcomes and patient experiences really are the gold standard, and such a great chance for clinics to differentiate themselves and really strive ahead using amazing tools like Physitrack to develop outcomes and create amazing experiences. Henrik, this has been incredible. From a professional perspective, I know that Physitrack is such a brilliant tool for so many clinics that we work with, both in the physical and towards the non-physical therapies also, but yourself personally, your journey as an entrepreneur and what you continue to do to push healthcare forward is really inspiring. And ourselves at Clinic Mastery, as well as the Grow Your Clinic podcast audience, are really grateful for all that you do for us. If listeners want to learn more about Physitrack as a product, or even follow you personally on the socials or websites, how can we find out more, Henrik?
Well, so Physitrack on the socials, we have a Facebook account, we have a Twitter account. The new developments and new things that we're trying to push that out there. I personally have a LinkedIn account. I occasionally write articles to aim at entrepreneurs with some of these things that we think about. For example, what I spoke about, to be your own venture capitalist, let your day job fund your venture. There's a nice article on that out there that might inspire one or two people if you're going through a tough decision on whether or not to leave that day job and to go into and to be a full-time entrepreneur. So find me on LinkedIn, Henrik Molin, CEO, co-founder of Physitrack. That's pretty easy. And obviously for the product, physitrack.com. We have people in Melbourne. And in other jurisdictions. I'm personally in the UK. Look me up. I'll take you for a coffee, and if you let me listen to what you do, then I'm happy to tell you a little bit about what we're up to as well. So we'd love
awesome,
that.
Man. That's so good. And listeners, we'll link all that up in the show notes over at clinicmastery.com/podcast. And specifically, we'll make sure we link up Physitrack, and you can head over there and set up your account, maybe a quick trial, and really engaging with your patients on a whole new level. Henrik, thank you so much for joining us, and listeners, thank you for sharing your time with us. As always, we really appreciate your attention as we share the Grow Your Clinic podcast. And Henrik, have a fantastic day. Thank you.
Thank you, Jack. You too.
Listeners, have a fantastic time, and we look forward to bringing you another episode again really soon. Bye for now.
Thanks for tuning in to the Grow Your Clinic podcast. To find out more about past episodes or how we can help you, head to www.clinicmastery.com/podcast, and please remember to rate and review us on your podcast player of choice. See you on the next episode.